Hello, everyone, and welcome to the Let's Talk series, episode 5, organized by Aesthetic Medicine India and powered by Galderma. One of our most recent introductions, the Let's Talk series, was launched last year. We have had subject matter experts and experienced aesthetic medicine practitioners join us as eminent speakers with our first episode on personalization with Restylane Define, followed by our second episode on lip fillers, our third on achieving radiant skin with original skin boosters, our fourth on bright eyes with Restylane, and today our fifth episode will focus on achieving excellence in chin and jawline creation with Restylane. I am Shriyal Sethumadhavan, the Executive Editor of Aesthetic Medicine India. And on behalf of the Aesthetic Medicine India team, I would like to thank our partner Galderma, our guests and speakers, and our viewers for joining us today. So what is the Let's Talk series all about? For those of you joining us for the first time in this episode, organized by Aesthetic Medicine and powered by Galderma, every episode of the Let's Talk series brings together two aesthetic medicine practitioners to discuss an aesthetic treatment along with case studies. Aesthetic medicine was founded in the UK over 18 years ago, and it is the original business-to-business magazine in India for discerning aesthetic professionals. I would say the magazine is a must-read for medical practitioners such as dermatologists, clinic managers, plastic surgeons, selected aestheticians, and cosmetologists. The Aesthetic Medicine Expo and Conference was introduced in India in 2019 with the aim of connecting the medical fraternity with the supply chain stakeholders and providing a platform for networking, sourcing, and training. Then came 2020, and of course, since the world was besieged with the pandemic. We at Aesthetic Medicine took on the challenge and set ourselves on an exciting digital journey. In all success, the Aesthetic Medicine Digital Series were introduced, and our webinars and online interactions with experts have been instrumental in bringing vital information to practitioners on various treatment and discussions revolving practice management. I'm also delighted to announce, and I would take this platform to announce, that we are gearing up to bring back our physical event in Mumbai. Rebooting the India aesthetic medicine industry, the Aesthetic Medicine India show, a blend of an exhibition and panel discussion among India's leading dermatologists, will take place on May 29th this year at the St. Regis Hotel in Mumbai. More details are available on our website, aestheticmed.in. So please feel free to go and check it out there, of course, after today's webinar. And we are available everywhere. Our updates are there all over social media, Instagram, Facebook, our YouTube channel. All you need to do is spot us by typing in Aesthetic Medicine India. So like I mentioned, today's webinar will focus on achieving excellence in skin and jawline creation with Restylane. Before I detail the topic and introduce you to our eminent speakers that we have with us today, let me present to you a video from our partner, Galderma.
Designed to allow you to be your naturally expressive self. So go ahead and laugh. Smile. Smirk. Frown. Or smooch. Because maintaining your natural self-expression is worth it. Restylane Refine and Restylane Define. Worth every expression.
The video is a patient education video, and you can contact your local Galderma representative to install the video in your clinics. In today's Let's Talk series, episode 5, we have Dr. Pankaj Chaturvedi, MD, Director and Consultant Dermatologist, Medlinks Clinic, Delhi, and Dr. Swati, Garg, Owner and Director, Smart Skin Solutions, Panchkula, Haryana, talk about the art of perfection and jawline correction with Restylane. Introducing our speakers with a few more words. Dr. Pankaj Chaturvedi is an internationally renowned dermatologist from New Delhi. He holds an MD degree from dermatology from prestigious AIIMS, New Delhi. And after starting his center, Medlinks, with a short span of time through his work, managed to attract a cult following that ranges from celebrities, expats, and socialites. He is committed to the continuous pursuit of learning and training and teaching, which allows him to provide the highest quality of care to his patients. He relies on his in-depth knowledge, advanced training, and vast experience to choose the treatment for each patient. He is also an international trainer on botulinum toxin, soft tissue fillers, suspension threads, and medical devices of various global brands. Also, please welcome Dr. Swati Garg, a young and dynamic dermatologist. Besides addressing the core dermatological concerns with the latest treatment modalities, she is passionate at customizing treatment regimens, combining the latest lasers and therapeutic modalities available to deliver results within a specific time frame. She specializes in clearing pigment in melasma cases of patients of skin of color. Her results in liquid facelifts, thread facelifts, and energy lifts are noteworthy. All in all, she helps and works towards helping her patients create a better version of themselves. Thank you, Dr. Pankaj and Dr. Swati, for joining us this evening. Request you to please.
Thank you. Thank you for the warm welcome.
Thank you so much. I would request Dr. Pankaj to take over with a presentation first, which will be followed by Dr. Swati and Dr. Pankaj sharing and discussing their case studies on today's topic. And the third part of the webinar will be an open discussion between both doctors and, of course, you, our attendees, as they will refer to your questions as well. On that note, a quick request to each of you. At the bottom of your screen, you would see a Q&A box and a chat box. Please only send in your questions in the Q&A box. If you put it into the chat box, chances are they would be missed. The chat box is for any communication you want to have with me, be it a sound issue, audio issue, you need any other information. Let me know in the chat box, but your questions need to get directed into the Q&A box so that we don't miss out on them. Doctors, we have 45 minutes for the discussion. We'll keep 45 to 50 minutes there and 10 minutes to look at the Q&A box as well so that we could take maximum questions from there. And with that, I look forward to an engaging session. And over to you, Dr. Pankaj. You could share your screen now and get started with the presentation.
Good evening, everybody. And today's session will be very interesting for the people who are just starting their practice with injectables. This will be quite beneficial for them. And we will also cover the issues faced by the advanced injectors. So we'll have a discussion which will be like basic as well as advanced. I'll start a small presentation so that we should know the basics. And then we'll talk about the independent case studies. Today we'll be covering the lower part of the face. Now, lower face is very important, and especially it is more important in Indians because in general, we don't have a very prominent jawline and a supportive bony structure. Europeans, the Caucasians, they have more pronounced jawline, and this is often ignored in Indian population because we mostly focus on the upper face. Now, in the lower face, there are basically three areas which we focus in the treatment. One is lips and perioral area. Second is jawline, and third is chin. When we age, there are a lot of changes which are undesirable. And these changes are not limited to the skin. There are skin changes, there are changes in the volume, there are changes in the muscles, there are changes in the ligaments and the bone, right? And we need to understand these changes so that we can treat individual issues and we can rejuvenate the face. When we talk about lips, there is gradual loss of volume in the lips. And along with that, there is also atrophy of the skin over the period of time. So there is loss of collagen in the dermis, and of course, there is a loss of volume in the lips because of loss of fat. Also, there is bony resorption. Because of that, the upper lip, it turns inwards, and the lower lip actually everts over the period of time. It hangs. So superficial lip tissues undergo distension and begin to droop. The vermilion border becomes larger, longer, and thicker at the corner of the mouth. So over the period of time, it is not uncommon to see the patients who are complaining that my distance between the lips and the nose has increased over the period of time because of loss of definition of vermilion border and slight elongation of this area. The filtral columns become less defined and the cupid's bow flattens. There is formation of perioral wrinkles and again, the same issue, loss of collagen in the skin. There is solar elastosis and loss of fat. Lips become more vertical and receded. The orientation of the labial aperture changes with the drooping of the lateral commissure. That's why The smile becomes little inverted, and the person looks little unhappy or sad in the resting phase. The upper lip becomes longer, and the projection of the upper lip is also lost, reducing the visibility of the vermilion regions. Now, yeah. So to address these issues, there are a few more changes which I would like to discuss. There are changes in the chin also. Because of bony resorption, the chin becomes a little shorter, and there is also changes in the bony structure of our mandible. Because of that, there is laxity, and there is poor definition of the jawline. Now, jawline is a tent. You can assume jawline is a tent raised on two poles. One pole is your chin, and second pole is your angle of mandible. So if there are defects in the bony tissue, the jawline will become less defined, and the person will look more saggy and plump from the lower part of the face. To address these issues, we have wonderful products from the house of Galderma. Whenever we want to treat and address these issues, we need to relax the muscles. We need to refine the look of the person, and we also need to make the person little refreshed. And to address these issues, we have good neurotoxins like Dysport. We have various fillers. One of the broadest range, I'll say most versatile range of the fillers from the house of Restylane. There is Lift, the Restylane Define is there. To fill, there is Restylane, and to volumize, we have Restylane Volime and Restylane Kiss. And of course, to give a refresh look, we have wonderful skin boosters. Now, in the Restylane portfolio, mainly there are two technologies. One is the Nasha technology, where there are firm gels which are designed to lift the tissue precisely without making it too volumized. And then there are products based on OBT technology, which are very flexible gels, and these are designed to volumize the area, and so that with the movement, we do not see much of distortion in that area. So volumize that area, maintaining the proper structure and the anatomy of that area. So the products in the Nasha technology are Restylane Lift and plain Restylane, and of course skin boosters. The skin boosters we use for the hydration. Mainly the product is Restylane Lift. So whenever we are treating areas which are bony areas like the jawline, the angle of mandible, where we need a product which has a high G prime, robust product which has a good lifting capacity, Restylane Lift is one of the best choices, because we need a product which stays there, and no matter how much pressure is there, it resists the pressure and doesn't spreads. So if you are treating somebody who has a little heavy face, needs a nice lift on the cheek, where we do not want to give too much of volume, Restylane Lift is one of the best fillers for this indication, where you can just inject a bit of droplet on the bone. You can achieve the lift without making that person look plump. So that's the beauty of Nasha technology. Now, when we are treating areas which are dynamic, like perioral area, nasolabial folds, and when we have to give nice contours and definition, we go for OBT technology. So Restylane Kiss is a little softer product, which we always prefer for the lips as well as the perioral area. And then there is Restylane Define, which we use for areas like cheeks and the temples. Now, Nasha technology is based out of a feature where we use technology where we use a controlled mechanism to select the particle size. There is less than 1 degree of cross-linking. So they have used a unique technology to cross-link the product. And there are two different sizes of particles. So these different gel textures, controlled particle sizing, result in distinct texture for the different lifting capacities. And here you can see in the ultrasound image, pre and post injection, you can see a very precise lift is there after the injection. here. In OBT technology, the products are designed in a manner so that they can get integrated with the tissue, and they provide the flexibility and they facilitate the movement. So areas which are mobile, OBT technology is the technology of choice. So fillers based on this technology are preferred whenever we are treating dynamic areas. Here there are 4 degrees of cross-linking for different variable firmness, and there is 3 degrees of calibration for variable particle size. So here we can see after the injection, the product is actually integrated in the tissue. There is a very nice lifted contour. We can't see that crisp lift which we just saw in the Restylane lift. We are seeing that area is elevated, but it is more smooth and rounded, and the product is actually integrated in the tissue. So that is the beauty of OBT technology. When we talk about skin boosters, the skin quality, hydration, glow, and a refreshed look is something which we desire can be achieved by Restylane skin boosters. Restylane Classic is one of the best products for classic tear trough, ideal tear trough. And when we need to lift, as I discussed, when we need to lift and do the structural changes, especially on the injections on the bone, we use Restylane Lift. Define is used for the contouring, definition, when we need a projection in the cheek, and when we are treating areas like perioral area where we need to fill the folds, marionette line, where we know that area will move continuously. So we need a product which is more flexible and elastic. In lips, Restylane Kiss, the ideal product of choice. Oral commissures, and jawline is the product of choice when we are treating temples, or when we are treating an area where we need good amount of volume. So like temples, pre-parotid area, Restylane jawline is the ideal choice. And as of now, there is no other brand in the country which is having such a diverse portfolio. If we see this graph, so here we can see the firmness on the vertical axis. We can see there is G prime, which is ranging from 0 to 800, and on the horizontal axis we can see its flexibility. So if you see, Restylane Lift is sitting on the top when we talk about highest G prime. So G prime tells you how hard the product is, how firm the gel is. And this is the reason why this has got the maximum lifting capacity. It is least flexible. That means you can't expect Restylane Lift to move with the movement. It resists any kind of movement. So this is the ideal choice where we are treating the jawline, as we'll discuss the lower part of the face, chin and jawline. So we'll be mostly using this product because these are bony areas and we need lift in these areas. The other brands like Juvenium Voluma, which is currently being used in the country as another choice by some other company, you can see the G prime stands somewhere around 300, which is even less than the half. So this is the reason that when we talk about the definition of the jawline and chin, these products which are soft in nature are not able to give that kind of result which Restylane Lift gives. And in the same spectrum, if we keep on moving, you'll see Restylane Define is standing the midway. So this has got G prime of roughly 240, 250, and it has a flexibility of 800. So this is an ideal choice where we are treating areas which are dynamic in nature because they have good amount of flexibility. So with the movement of the tissue, you won't see distortion of the facial expressions. Rather, the product harmonizes with the facial expressions and stays there. It doesn't move, integrates with the tissue, and you won't see that the person has got a different expression after the injections. So that's the benefit of using a product with good flexibility. So on this axis, we can see the the good flexibility is there with the Define. It has got a moderate, you can see firmness and moderate flexibility. And then there is Restylane Voline. It is a little softer, it's more flexible, and you can see the G prime is little lesser. Restylane Kiss, again, the G prime is around 100 with increased flexibility, because we are treating perioral area, which is the most mobile area on the face. We talk all the time, nasolabial folds, marionette lines. So these are the areas which move a lot. So we need a product which is having good amount of flexibility, and the product feels natural. So Restylane Kiss. And then Restylane Refine is there, which is a very, very soft product. So this can be used to fill the fine lines, and has almost no lifting capacity, just to fill the lines and wrinkles. Now, this is one of the study which was done on Restylane Define. So you can see the baseline and 42 days after the expression. And we can see that it has got integrated with the tissue. And after treatment with Restylane Define, the patient was making the same facial expressions. And in fact, the strain exerted got reduced to help to make the same kind of facial expressions, and of course to help restore the youthful look. So here we can see that OVT has completely got integrated in the tissue, and so this is the beauty of this OVT technology. Now, when we'll be talking about the injection in the lower part of the face, is very important for us to understand the anatomy, so that we can follow the safety parameters. The most important is to understand the blood vessels of the lower part of the face. So when we talk about the jawline, so we need to understand the anatomy of the facial artery. So facial artery crosses the mandible just on the anterior border of our masseter muscle. So if you put your finger on the anterior border of the masseter at the jawline, you can actually feel the pulsations. So before injection, it's important to mark that area so that we can stay safe. So facial artery and facial vein is very important to understand. Second, the blood supply of the chin comes from the mental arteries, and mental arteries are the branches of inferior alveolar artery, which is the branch of maxillary artery. So when we are injecting on the chin, especially when we are volumizing the lateral half of the chin, we need to take care of this mental arteries, because they arise from the mental foramen. Also on the apex of the chin, or just below the symphysis of the mandibular, this upper mandible, there is one more artery, which is branch of our facial artery. So that is there, and that is one of the most commonest causes of bruises when we are giving direct injections on the apex of the chin. Other than that, when we are treating when we are correcting the mentolabial angle, and when we are filling this labial crease, so we need to be careful about the inferior labial artery. So these are the arteries which are important when we are treating this particular area. Now we'll be talking about various case studies. We'll show the different cases where we have treated the lower part of the face using a Restylane range of fillers. So I'll invite Dr. Swati to start with her cases. Welcome, Dr. Swati.
Thank you, Dr. Pankaj. It was an elaborative discussion.
Yes.
Please maximize the screen. Yes. This is the first case study. Could you please just shift next, Doctor, so that we can see the before picture of the case? Yes. One more before, Doctor. Yes, so this was the case that came to me, and all she asked is, doctor, just do something for my lower face because I'm not happy with the way I move. with my lips. I'm not happy with the way I talk. So this was all that she asked for, and she said something for the lower face. So why I've included this case for the discussion is that she came asking for lower face, something to be done on the lower face. And then when I examined her, she was having a characteristic enrolling of her upper lip. So yes, this is the after picture that is there. So there is a characteristic enrolling of the lips that is there on when I examined her. And there is also asymmetrical upturning or retraction of nasolabial fold when I examined her. So, and there was also a scar at the inferior ala. So when I asked her, she said she's got her plastic surgery done on the mid face. So removal of buccal fat pad has already been done in her case by some other plastic surgeon. And she said she's done her mid face job done. Now she wants something for a lower face so that she could smile better, she could talk better. So what we did for her is, so when I just came to know that she is asking for something for the lower face, then that was what she wanted out of me. Then I just had a word with her, just talked to her, and then made her realize what she actually needed. So what we did for her is we did 1 ml of Restylane Define in her nasolabial fold along with the labiomental crease. And also I've done 1 ml of Restylane Kiss for her lips. So just 2 ml of fillers for her has relaxed much of her lower face and has actually made her lips rest better on her teeth. And she was very happy with the way she has started to move her lips now and the way she has started to move her face. So I've characteristically included this case just to highlight the point that what patient asks from us might not be very saying what she needs from us. So she was asking for something else, as she has already done her lip mid-face job from some other plastic surgeon. So she was asking something for the lower face. So this is how we have approached this case, and this is her before picture and this is her after picture. Dr. Pankaj, I would like to know your opinion. Would you have done something different, or how would you have approached this case a little differently or in the very same manner?
I think this is the exact approach I would have taken, because like whenever these concerns are there, so there's the ideal approach to treat the individual issues so that we can enhance the outcome of the area. So
Okay.
exactly the same approach.
Yes. So the next case, let's discuss that. Yeah. So this was another case which was a typical retronethic chin. Of course, we can better appreciate the retronethic chin in the lateral profile for her, and she's having a short chin. So she came characteristically asking for a chin filler from me. So a very simple case, we have done 2 ml of Restylane Woline. I've chosen Restylane Woline for her. So 2 ml of Restylane Woline just to improve her chin. So I've given a better projection, better interior projection, and less of a shadow effect in her lower face. So a better light shadow effect on the frontal profile and a better lateral profile we can appreciate clearly in the before and after picture. So next case will be, next case, please, doctor.
So very good change, doctor. And I'm pretty sure that the patient must have got a budget constraint. Otherwise, yes, I think yes, 1 more ml could have been used as the pre-jowl sulcus. Yes. And because you can see how significantly the double chin has got improved in this patient. Yes. And in the lateral view, you can see that still the chin is not having that much of projection and elongation. So a bit of correction of the pre-jowl sulcus and a bit of the anterior projection could have been given to this patient if the budget allowed, I guess.
I wanted the product in the midline only. I insisted that yes, she should be getting marinades done, but she wanted the product in the midline only.
Right.
Yes.
Next patient.
Next, yes. Next, again, a very special case of mine where again, retronethic chin, she wanted projection of the chin. So we did 2 ml of Restylane Woline for her, and then can we see the after picture? After picture, doctor. Yes, so this is her after picture after 2 ml of Restylane jawline. Again, pretty much straight approach with the chin. We have done her labiomental crease as well as chin apex with a little bit on the sides of the chin to build her chin. So this is her final profile, just taken immediately after the procedure. Yes, so this is like a peculiar book picture of a lower face aging. We can clearly appreciate the nasolabial fold. We can appreciate a marinate fold. We can appreciate the formation of a prominent jowl in the jawline. So there is loss of the sharp jawline that we want. So thinning of the lips is also quite visible along with the hollowing of the medial cheek. So this is the characteristic mid-face and lower face aging that we would appreciate in her case. And there's medially downward sagging of the whole of the face, and there's attenuation of the mandibular ligament also. There is mesenteric cutaneous ligament that is also sagged out, and there's skin atrophy also. There's bone resorption also. And we could appreciate almost all the changes that we see in a typical aging face for the lower face. So this is, I am sure, Doctor, these are one of the most common cases you would be appreciating in your practice also. So once any of such case, it comes to you, so how do you approach to these cases? I mean, straight away, how do you counsel them? How do you just tell them, what is your approach out of these cases?
Biggest issue is that these patients, they have a very high expectations with the fillers, because most of these patients, they look at the age of patients. So these patients, they haven't taken the fillers ever, and when they start, they have very high expectation that probably 1 ml of filler going to do the magic. So I normally start these patients with good amount of counseling. We tell them that, okay, tell me which area bothers you the most. I also understand how much budget they have, because this kind of face requires at least 8 to 10 ml per in first session, and maybe a bit more after a couple of months. So these patients, I would have first corrected the angle of mandible. I would have given 2-3 ml of product there, so that we can, and the pre-parotid area, so that we can correct the jowls. And then correction at the pre-jowl sulcus. And then, yes, a bit of correction of nasolabial fold in the marinate line, and a slight volume correction of the lips. So maybe in 3 ml, I would have made patient a little happy. But yes, this patient required good amount of volume.
Yes, I completely agree with you, doctor, because since jawline and children, they, I feel, are filler hungry areas. So whatever you tend to put in, always tend to fall short only. And for me also, I think lower face is always an indirect correction. So it always requires mid-face correction first, followed by upper face in case it is required, and then it has to be shifted to the lower face. And so for her, I think what was the case with her is she is an injection phobic patient. Okay. So in spite of every effort, in spite of the right communication, right counseling, and division of her treatment into sessions, she was filler phobic, plus she didn't want to divide it into multiple sessions. So could you show the after picture, doctor? So this is an after picture. So good correction of nasolabial fold, marinate fold also, and little correction of jowl. But this is the result only after one session of energy-based device or Altera. This is not the result with filler. So why have I included this picture into the presentation is, yes, when we talk of designing the chin and the jawline, first, there is no ideal chin and there's no ideal jawline. Perfection is very subjective, so is the aging. So, and there is subjective attitude of the patients regarding the treatment options that we choose. So I have presented her with options, including the fillers, options including the threads, options including the energy-based device. So since sometimes we can't go by all our whims and fancies by the way that we want to correct it, we have to take the budget also into consideration and her number of visits that she would require for full correction. But this is just the result after one session of energy-based device, and she was quite happy since she was filler phobic and she was toxin phobic. So this is that what we could achieve for her, and she and along with her family members, they were quite happy with the result. So next case, doctor, please.
Very correct approach. In fact, I would have recommended same to this patient. I normally start these patients on energy-based devices, and then sometimes I do a bit of suspension thread lift, and then I move to injectables, because it's very difficult to convince these patients to go for 6-8 ml of product in one go, and especially when they come to know that it's going to last for 1 year only.
For a year or so. Yes, true.
Yeah.
True. Yes, this is also a very interesting case. She's a patient who had come for the treatment from abroad, and she's having unilateral mandibular aplasia. So she was having one side of the mandible which was not developed since her childhood. And at one point of her life, she had refused bone grafts earlier during her age. And presently, because of some family issue at her end, she wanted to meet some guy. So what she asked from me is, doctor, just give whatsoever possible correction that is possible for me, and whatsoever correction you're able to achieve in my face, I just want it for myself, and that too without a bone graft. So all that I've counseled her, managed her, was 4 ml of filler that has been given to unilateral one side of a face, and I was able to create this angle for her, and she was so happy. And I would like to share that seeing her face after the correction, she literally cried at my office, and she said, this is for the very first time that I could feel one side of my face. And yes, of course, this is partial correction only, what we could achieve, because what I believe is I do inject not more than 4 ml in one go. Even if the patient just insists for more filler, I always tell, just go to your place, just have a cup of tea and come back for another 4 ml from me a week or 2 weeks later. So I am a little conservative in that approach. Even if they are ready for more ml, I would just inject 4 and then send back home. So this was the result after 4 ml of filler that I gave her on one side of the jawline. And I included, just to include, that sometimes little correction also of a deformity, and that too of a congenital deformity, can give life transforming results, especially at the need of the hour for the patient. So your comments on it, Dr. Pankaj?
Very true. Beautiful change. And of course, when these kind of patients are there who haven't got desired results over years, when they see this kind of change happening within a few minutes, of course, they're overwhelmed with the joy. This patient, I think you could have also convinced this patient for a bit of toxin in the chin so that we can relax, so they can see there's a lot of pimpling in the chin area, and then we would have done a bit of
yes, we did that, doctor, but since this is the immediate picture, we could not appreciate the results that came. Yeah, so we did that for her.
Yeah,
but yes, I think seeing these kind of results, I would like to appreciate that aesthetics have now gone beyond how you look to how you feel.
Very true.
So they are now being able to give that kind of a mental change in that attitude, the feel-good factor that they have, the increase in confidence that they have after getting fillers done, and that too in a period of about 15 to 30 minutes, that kind of a change and revolution that brings confidence to them. So that actually satisfies you after doing the procedure by the end of the day.
Very true, doctor. So this is the beauty of fillers. Like there's no other treatment which can give on-table results. Like within minutes, you can show what you promised. Inspiring.
Yes. Next.
Okay. So yes. So now I'll be showcasing few of my cases. So now, she is a very famous Instagram blogger and beautiful girl. You can see the skin is also good, but she wanted a bit of leaner look. She always said, doctor, you know, and she's a little plump. So I just did 1 ml of Restylane lift in the chin area. And you can see this is an instant result. Weight loss happened over a few minutes. So
Yes.
So whenever patients are there, sometimes they ask for, they don't know what needs to be done. So when a patient wants a slimmer look, so we normally see what can be done on the upper face and what should be done on the lower face. Upper face, if you see a very good bony structure, cheeks are full, and there is no scope of doing any kind of filling on zygomatic arch. Now here, you can see the chin is a little shorter. And if you look at the forehead and the nose area, lip is little overhanging, lower lip. So just by doing a bit of volume correction of the chin, the person is looking better, slimmer.
We've added lip and eyebrow-orbital correction also by adding.
We did very subtle correction of the lip also, and a bit of teardrop correction. Yeah, so this is, so I use 0.5 ml Restylane Classic for the lip and the under eye, 0.5 ml each.
Remaining in the under eye.
Now, the next patient. Look at this. So this patient came to me to get a rhinoplasty done. She said, doctor, you know, I want a rhinoplasty, but surgery is the last thing which I will ever prefer in my life. So do something without doing surgery. Maybe you do my nose fillers and correct my nose. Now, if we do facial assessment, doctor, if this patient would have come to you, what would have been your approach? What you would have thought and what you would have done?
Since she came for rhinoplasty, of course, that is one of the primary need that we need to address, of course.
Yes.
Liquid rhinoplasty is something.
But she never wanted a surgery.
She never wanted a surgery. Okay, so
yeah.
Again, liquid rhinoplasty, that is the filler correction or the threads that is the primary correction for her. But since she is also retrognathic chin case, so a very short retrognathic chin is there. And yes, a chin filler could do wonders to her profile, along lateral profile as well and the frontal profile. So once we could give her, if we could convince her for a chin filler, that would do much of the better profiling for her. So that is something that should be, of course, counseled along with the nose.
Perfect. So this is what we did. So we exactly did what you said, doctor. We injected 2 ml of product, 2 ml of Restylane lift we use for the chin, and bit of correction of the nose. No, she's actually a case of rhinoplasty, but we did a bit of correction of the nasal bridge to make it a little straighter. And 1.5 ml of Restylane lift. You can see chin is better, marionette lines are better, lip is looking better, and now she can see a jawline.
Yes.
So that's a beauty of Restylane lift, because these patients who have got retrognathic chin, the chin is very tight. It's not easy to elongate and project that chin. You really need a product which is robust and has a good G prime. So I don't think any other filler would have done this job.
Lift is a beautiful product for jawline, doctor, because we don't want to make the chin and the jawline bulkier with volume or define. So we want a very good G prime and a robust product for that.
Yes. This patient, one of my Spanish patient, and beautiful girl with nice features, chiseled face, no fat, goes to gym. She wanted to become better. So she was not sure what she wants. And we told her that we will be enhancing the features. So we did a bit of correction of the jawline and the chin area, a bit of correction of volume correction of the cheeks. This is what we have. So you can see jawline is more defined, features are looking better. Even the same lips, we haven't done anything on the lips, but you can see these lips are also looking better. Total, yes, total product was used just 2 ml. So refined, so 1 ml Restylane lift and 1 ml define. This patient. Now, this patient was not sure what she needs. She just said that she wants to look beautiful. And I asked, look, that what bothers you? So one of the things was my double chin bothers me. I'm fat, but I do not want to go for any kind of surgery. And I do not want to do any kind of gymming, sedentary, typical sedentary lifestyle. Now, these patients, you can't actually convince them that, okay, weight loss is something going to help you over the period of time. But as a dermatologist, if you do an assessment of this kind of face, you'll find that in the facial features, the mid face is lacking in the volume, chin is short, chin is actually broad, right? So whenever we see these kind of faces, this is a masculine chin. If you see the chin is broad and there is a bit of groove in the chin. So just the correction of the chin to give a narrow apex, which is as broad as the nose, has done the job. So here we have done 1 ml of Restylane lift in the chin, half ml of Restylane defined on the cheeks, and half of the defined we have done in the jawline area. So total 2 ml of product, and we can see that in the side profile, the double chin is better. The face is looking slimmer and lifted. If you see this middle, like these two pictures in the middle, you'll see that face is looking much more slimmer. So just by replenishing lost volume in the correct manner, we can make the face look slimmer, more balanced, and of course, correction of the chin also works very well to conceal the double chin.
You could have added an RG-based device for her, doctor.
Yes, so after that, actually, we started her on sodium deoxycholate injections and HIFU for the double chin area, and she's under the treatment. Let's see how it comes out to be. Another patient, the concern was the double chin, and she is a model. She's Indian, but she does modeling for Brazilian brands. So because of her assignment, she said that she wanted a quick fix for the double chin area. And so doing any kind of EBD, doing any kind of liposuction of the chin area or lipolytic procedure was out of question. So here we just did 2 ml of Restylane lift on the chin and on the jawline area, and you can see the double chin has vanished in half an hour's time. No double chin, it never existed. So that's the beauty of the lower face. If we know the anatomy, if we know where to inject, right? So when we are treating the chin, we have to give anterior projection and we have to elongate the chin. Both things has to be there. If few patients, they have a folded chin, so we need to open up the mental crease by using a cannula. To elongate the chin, we normally inject on the bone so that the chin gets longer. And to give anterior projection, we use a cannula to increase the volume in the upper part of chin so that it gives a nice anterior projection. So nice piriform lip chin is the ideal chin which we aim for. Now this case, so one of my patients from Australia is a young model there, and so he's doing modeling since he was like 12 years of age, and when he came to me, he was 19 years. And he said, doctor, my image has been always been like a teenage model, but I want to break that image, and I want to look more masculine. So this is what we did. We also did a couple of procedures, so you can see a few blood stains on the face, but you can see the chin. So when we treat the chin in men, we have to maintain the angle. So feminine chin is more round, piriform. When we treat chin in men, it has to be angular, it has to be broad. This has to be maintained. Otherwise, the chin treatment in a male can become a disaster if you make it round and pointed, right? So the face looks more feminine. And if we are correct in our approach, we can actually make a face look more masculine. So this is one of the very good use of fillers for the patients who want to look more masculine. So we need to deposit some product on the angle of mandible so that the face looks a little broad, followed by injecting the product on the chin, maintaining the groove in between and maintaining the breadth of the chin. So there should be elongation, there should be projection, and the center part we normally do not inject much. So we create two pads laterally, and there is a groove in between so that the structure stays the same and the chin projects further. What's your comment, Dr. Swati, on this?
Beautiful results, sir. I would like to congratulate you. Included this male case study for discussion. So for males, I always believe two squares, they have to be created. One, the square chin, and the other, the boxy square face. So I think square in a square is what every male would want for a chiseled jawline, for a younger, youthful chin. So yes, we want a squarish chin, which should actually be covering both the oral commissures in the center of the face. Instead of being a pointy chin, we want a squarish chin for males, along with a squarish jawline. So that makes a broader, squarish, chiseled, sharper face for a male.
Now, this patient. So patient was basically not happy with the lower part of the face, and she said, "Doctor, I want to go for the tightening procedure because I think my jawline is not very well defined." And if we see closely that the patient is having very prominent this mental crease, and the chin is not very well defined. It's a bit short. We can also see there is a bit of jowling here. So at this age, most of the patients do not have sagging. If the sagging is there, mostly because of the bony defects, probably the underdeveloped bony structure of the lower part of the face. Just 1 ml of Restylane lift, and you can see much better jawline. And overall, if you see, the face is looking much more refreshed and relaxed. It's looking a happy face. So that's the importance of balancing the features. If we do not correct the lower part of the face doesn't look very pleasant. The face looks a little saggy. The person looks sad. So when we correct the lower part of the face, the chin and the jawline, even the lips look more beautiful. And so we can see that just by opening up the chin. So how I treated this patient. So first I corrected this mental crease. So if you see, the lower lip is looking little as if it is hanging. And in the second picture, you can see the lower lip is looking more normal. This hanging look is not there. And so I injected 0.5 ml of product here, and the rest of the product was distributed to elongate the chin and to correct this pre-jawl sulcus. Dr. Swati.
These are one of the few cases where even the direct correction with a very little amount in a younger patient gives beautiful results, doctor. So these are the cases where we don't require mid-face correction per se before lower face.
Yes.
Beautiful.
Another patient, the complaint was double chin, sad look, and these patients actually, like, it's very difficult to convince them that there's a structural problem with the chin. They don't understand. They say, "Doctor, since I'm a little heavy, since the fat is there, probably that is the reason." And if you say, "Yes, I agree," which is the fact, the fat is there, but how to reduce that fat? The person doesn't want to go for any kind of treatment which gives swelling. So injection, lipolysis is out, liposuction is out. Energy-based devices are not that efficient in reducing the fat. Of course, they can make the tissue tighter, but at this young age, sagging is not the problem. The problem is the fat. But the bigger problem is why this double chin is more visible, because of short chin. If the chin is short, of course, the double chin will be visible. And many patients, if we who are skinny, as I showed you that patient who wanted that rhinoplasty, she also had a concern of double chin. I said, and she's a skinny girl. She's a very famous anchor, and she said, doctor, I don't have fat, but I don't know why my double chin is not going. The problem was there is no double chin, but there is no chin. So that's why whatever is there, the submental area, that is visible as double chin. Now in this patient, we did the correction, and you can see double chin has vanished, and the jawline is looking much more defined and sharper. Here we use 2 ml of product, 1 ml of Restylane Lift and 1 ml of Restylane Define. Even the lips are looking better. So whenever we see that person is having an appearance as if the person is grumpy or the lower lip is hanging, we should always see that how deep the mental crease is. If we just correct the mental crease, that hanging look can be corrected. The grumpy look goes away. And this is our beautiful doctor, Dr. Swati. Please, your comments.
This picture was included for a specific reason. This picture was taken on a New Year's Eve, this New Year's Eve only, doctor. So this is my 4 months later, before picture. And this is, can you show the before picture, doctor? This is what it is after masseter. I mean, why I've included this picture is there are 2 things that has been done with before and after. One is the masseter injections and the other is DAO. So this is the toxin correction of the lower face. So from a squarish face, it has become more of a V-shaped jawline and a more oval face, and almost much of a balance just by toxins. So why I've included this, my own picture into this series is because when we talk of designing the jawline, there are multiple modalities beyond fillers, allergy-based devices, and threads. We can always shape a jawline. We can always redesign the shape of how your lower face can look just by toxin as well. So this is what it is after masseter, 40 units of masseter and 4 units each side of DAO. This is the result of my own experience, and I'm again a little bit due for masseter. So what have you been doing in this phase, doctor? This is what has been done. Toxin is the only thing that has been used.
One of the best results of masseter, I'll say, I've seen of late. One of the best results. Very nice.
I always used to think that Shilpa Shetty is the one who has the most bulkiest masseter, but now I think I am the one who is having the most bulkiest masseter.
So any lip fillers, doctor?
No lip fillers, doctor, only masseter. By far, I've touched my face just with toxin.
Very, very good.
So coming on to the Q&A, doctor, let's just quickly take up the questions that are there. Shreyal, do we have time for taking up questions?
So what I will suggest is, first of all, thank you so much, Dr. Pankaj and Dr. Swati, some great case studies to discuss over there. Dr. Pankaj, you could stop your share screen right now. And
Sure.
For all our participants, this is your time. If you have any questions for our expert panel here, please put them into the Q&A box. In the meanwhile, Dr. Swati, you could start your open discussion with Dr. Pankaj. We are a little short on time, so I would say let's keep the next 10 minutes for our discussion. And if any Q&As come in, we could take it along the same discussion.
The questions that are there, doctor, let's just talk about them. First is using cannulas over needle. So I would say that cannulas or needles, they are much of a subjective choice. There are certain areas where cannulas are better and there are certain areas where needles are better. So I would say chin apex or a mandibular angle, one could prefer a needle, or the stem of the mandible or the pre-jowl or the post-jowl injections. I think cannulas are much more safer because of the facial artery. But I think it is again a very much subjective choice. We can control our volume better with needles, and we can be in a much more safer plane with less neural trauma and less vascular trauma with cannulas. But still, having said that, I would still say that cannulas which are greater than 25 gauge size, that is, they are as good as needles only. So I would say that 23 gauge or 25 gauge is the ideal cannula size that should be used for the lower face. What do you say, Dr. Pankaj?
So cannula and needles, both of them, they have their own pros and cons. And I use both in my practice, depends which area I'm injecting. So let's talk about the lower part of the face. So the apex of the chin, I always do with a needle, because you can't achieve that kind of lift and projection with the cannula, because that injection has to be there on the bone, should be supraparietal injection. Again, when I'm correcting the angle of mandible, I usually inject on the bone with a needle, because that crisp definition is difficult to achieve by a cannula. You have to be very superficial because the masseter muscle is sitting there. So either you do subcutaneous layering of the product, which may not be a good idea, because when people have a bit of sagging and loose skin, sometimes the product moves, because subcutaneous tissue may not be able to hold the product for a long period. And of course, by using cannula, you can't do intramuscular or submuscular deposition of the product, because masseter is a mobile muscle. It's a muscle of mastication. So ideally, it should be on the bone with a needle. Then the ramus of the mandible, I inject with a cannula, because we know there is a facial artery sitting there. So a cannula, as Dr. Swati said, that cannula which is ideally 23G is the cannula, because the products which we are using here, they're viscous products, and it's not easy to extrude these products through 25G. Plus 25G cannula is pretty sharp, and if you're moving here and there, you may penetrate an artery. I usually aspirate with a cannula when I start my injection. It's difficult to aspirate when there is product in the cannula. So unprimed cannula can be aspirated, should be aspirated, because a couple of times I've got positive aspiration in my cannula also. And I do not use cannula of 27G or a smaller size, because they're actually needles. There are higher chances of making an error and doing a disaster by using finer cannulas, because you'll not be that careful.
So next is, what are the post-treatment precautions with fillers?
Post-treatment precautions are simple. First of all, after the treatment, you should yourself examine the area. You should see there shouldn't be any kind of blanching, and you should make it a practice to, it's like it's a mandatory thing which you should do after the injection. Look at the area. There shouldn't be any area of the blanching. Number one. Number two, ask about the pain. How much pain is there? Because pain which is too much is also one of the, it should raise a suspicion that there can be a vascular event. So these two things has to be there. Third, of course, tell the patient to do icing on that area, so that the area doesn't inflame much. You can give, I normally give a short course of, like, it's one single dose of 20 milligram of prednisolone if I'm injecting good amount. Whenever I'm inject more than 3 ml, or if I'm injecting lips, I give one dose of prednisolone, so that there is no swelling, and it also helps in the pain a bit. We tell the patient not to do any kind of strenuous physical activity for 48 hours, because it may increase the chances of bruising. And we also tell them to tell us how much pain is there. If there is too much of pain, on a scale of 1 to 10, if the pain is at the level of 7 or more, then I call the patient back for a follow-up, and I make sure that everything is fine. Otherwise, mild pain, discomfort, patients know that, of course, they have taken a filler, a bit of discomfort will be there. So these are the precautions. And of course, blood thinners should be avoided before the procedure, and after a day, after 24 hours, they can start. These are the common precautions, nothing major.
Avoidance of a heavy exercise for 3-4 days, doctor, and along with avoidance of facial massage, because every time I see patients, they're too crazy for getting massage or facials done. So avoidance of facial for 1 week, along with the precautions that you have mentioned, they are the ones that should be advised.
Yes.
And another thing is maximum amount of filler to be used.
Okay, so this is quite a debatable topic, and it depends on patient to patient. Maximum amount which I've used in one go is 13 ml. I've used a couple of times 10 ml of product, and I often use 6 to 8 ml in one go. It depends, like one of the patients you showed. So I see how much is the budget of the patient, and depending, if I'm doing a full face correction, of course, I use this much of volume. However, if I'm treating a jawline, I do not cross beyond 6 ml, especially when I'm treating a masculine jawline. So after I did a jawline for an actor, it's like his shooting was about to start, and he said that his role requires a more masculine look because he's like, role is like a macho. So 6 ml, 5 ml, 6 ml product is like it is a normal quantity which is used for a person who actually has a good jawline. A person, a male patient, if the chin is okay and a person wants to look more chiseled and enhanced, 5-6 ml product is not too much, because 2 ml product easily goes in the chin, sometimes 3 ml, and half ml for your mandibular angles, half ml for the jawline area, half a milli side, and then we also correct a bit of to give a bit of hollowness here. We may give a bit of lift to the cheeks so that they look high, they look hollow, like your buccal area looks little hollow and jawline looks more prominent. So that makes them look more masculine, like typical Brad Pitt look. And otherwise, it depends on person to person.
As I say, chin and jawline, they're filler hungry areas. So the more is always less. So another is the longevity of the fillers, doctor. How is the longevity? Your take on that? How much do you commit to the patient?
Okay, so it depends again on the areas. So I've seen the fillers in the under area, they last maximum. I tell my patient that 1 year is the average, and if you're lucky, maybe later. I've seen patients for the teardrop where the results have lasted beyond 2 years. In fact, my own teardrop lasts for 2.5, 3 years. When we talk about lips, 6 months is the time I tell my patient that fillers, they have a life of 1 year, but after 6 months, don't expect the results will be that great, because it's a mobile area, and over the period of time, because of hyaluronidase which we have, the volume goes down slowly. So after 6 months, if you want, you can take a top up, but the effect of the filler is going to last up to 1 year. We can say that yes, a bit of filler is there by the end of 1 year, but not necessarily the volume will be the same. When I'm using stronger fillers like Restylane Lift or Define, I tell the patient 10 months to 12 months, and after that we need to repeat it again. But I also counsel my patient that not necessarily we have to wait for the fillers to go completely. Rather, I call them for a bit of top up after 4-5 months. And I tell them that once you achieve this look, it's easier to maintain it rather than going for the 10 to 12 syringes in one go. So every 3-4 months, we can do 1 or 2 syringes, and this is how we can maintain the same look which person has. How do you counsel your patients when they're coming for the fillers?
I always tend to tell them, doctor, 1 year is the longevity if right amount is injected. And if even the lesser amount is injected, like if there's already 4 to 5 ml of filler requirement, you're already opting for 2 ml, expect the product to last around 6 months only, and then come back for a touch-up. So 3 to 6 months touch-up is what is required if lesser amount is what is injected. So if right amount is injected, I tend to tell them about 1.5 year time. That is what I say. Doctor, there are other questions also in Q&A box. So the first question is, which product is used in case of jaw implant patient? Yes, Restylane jawline was used since I wanted the more volumization of the area and I wanted it to actually stand out. So I used Restylane volume in that case. There's another question. I got swelling even.
Dr. Swati, I'll just take one question from the chat box as well, because I think we're running short in time now and we need to conclude this session. So in fact, we'll just take one last question, which I'll take from the chat box. Do the areas become hollower than before after 1 year?
After 1 year?
Yes.
For this, I would like to say that after filler injections, it has been said that when the imaging of the area has been done, they have found the filler to stay even after 2 to 3 years of injection. So what they say that the requirement of the filler actually reduces with time if the same area is injected. So we can't say it becomes more hollower, but yes, with aging, of course, the hollowing of the face definitely increases with passage of time due to the effects of aging. So it doesn't become more hollow with time for sure. That is for sure if the same area is injected.
Dr. Pankaj, anything that you would like to add here?
So this is the biggest misconception that after taking botulinum toxin, will my wrinkles look more pronounced when the botulinum toxin is going to wear off? Or if I'm taking a filler, once it goes off, will I look hollower? So this is a misconception. These products do not make you dependent on them. So if you have taken 1 ml of filler, it is going to stay and it's going to go. It's not going to alter the volume which you had. So you will become the way you were, plus that aging of that 1 year. So your aging is ongoing. And of course, that 1 ml product which was there, it is going to go. So you'll become the way you were. If you have lost weight over the period of time, of course, you may require more volume. If you have gained weight, you may not require that volume. And also these fillers, the multiple studies, they stimulate your own collagen. They actually make you better over the period of time. So I won't say that you will require less filler over the period of time, but yes, you'll be better than what you were. You won't go into negative.
Perfect. Thank you. Thank you so much. I think this was a very informative discussion, and you both have been so articulate to cover so much within a short span, which only forced me to extend this session, which I rarely, get to do. So thank you so much for all your time. With this, we come to the end of today's webinar on achieving excellence in chin and jawline creation with Restylane. The webinar was organized by Aesthetic Medicine India and powered by Galderma. I would once again like to thank Dr. Pankaj Chaturvedi and Dr. Swati Garg for being a part of this webinar and sharing such great insights. It was indeed a great pleasure hearing from both of you. Our partner Galderma, thank you for all the support. I would also like to thank the viewers, our participants, for your support and presence at the webinar today. As we come to the end of this evening, here's looking forward to positive, safe times ahead for all of us. We already seeing a lot of change in the tough times that now we are leaving behind, or rather have left behind. Thank you once again. Have a lovely evening, and I will see you all soon with our next episode on the Let's Talk series. Till then, goodbye and take care.
It was a
Bye,
pleasure.
Shreya. You were a wonderful host. Bye-bye.
Thank you. Thank you. Thank you so much. Have a great evening.
Good
Bye.
night and enjoy your Saturday evening.
Swati. Bye.
Yes, you both too.